Ms. Rogers. How are you doing today?
I'm good. How are you?
Good, thank you. My name is Brittany, and I'm going to be your nurse today. I'm going to be performing an eye exam on you. It should take roughly about 10 minutes. Do you have any questions before we begin?
No.
No? Okay, great. All right, Ms. Rogers, so the first thing we're going to start off with is testing your visual acuity with the Snellen chart. So if I could, I'm just going to have you walk you over there, and we're going to stand about 20 feet away from the chart. And we'll start first with your right eye, then your left eye, and then we'll do both eyes.
Okay.
Okay? All right, Ms. Rogers, I'm first going to have you cover up your eye with this opaque card. First, go ahead and cover your left eye, and we'll assess your right. Go ahead and start off with the smallest line that you can read.
7.
7? All right, so we'll start left to right.
FELOPZD.
All right, and then we'll go ahead and move on to line 8.
DEFPOUEC.
Okay, so your right eye vision is going to be 20/25 minus 0 without correction. So can I go ahead and have you switch over to your other eye, and we'll be now assessing your left. So go ahead once again and tell me the smallest line that you can read.
8.
8? Okay, so we'll go this time right to left.
CETOPFED.
Okay, so then we'll go ahead and move on to line 9. Once again, we'll read right to left.
TCPEOFEL.
Okay, so your left eye vision is going to be 20/20 minus 0 without correction. And now we will do both eyes. So once again, the smallest line that you can read.
8.
8, okay, so we'll go left to right.
DEFPOTEC.
Okay, so then we'll move on to line 9.
LEFODPOT.
Okay, so then your both right and left eye vision is going to be 20/20 minus 0 without correction. Okay, Ms. Rogers, now we are going to be assessing your near vision. If you could just read the second paragraph in here for me, and just read the first 2 lines, and hold about 14 inches away from your face.
Okay. Call your healthcare provider right away if you have pain in your lower leg that does not go away, severe chest pain, or heaviness in the chest.
Okay, so I'm going to note then that your near vision is intact. And now after assessing both your distance vision with the Snellen chart and your near vision with the reading material, I can say that your cranial nerve number 2 or your optic nerve is intact. All right, Ms. Rogers, now I'm just going to be assessing your external eye structures. So I'm going to come around to the front, and I'm first going to be assessing your eyebrows. I note that they are full in thickness and that they are symmetrical. I also note that they are symmetrical with changing facial expressions. I note that your eyelashes are full in thickness and evenly distributed on both the upper and lower lids. I note that your orbits and eyelids are equal bilaterally, and I don't see any redness or swelling. I note that your iris is hazel in color. I note that it is flat with a regular shape with even coloration. I'm going to now be assessing your conjunctiva. So if I could just have you look up at the ceiling and maybe pulling down on your lower lids. All right. I note that the conjunctiva is a soft pink, and I note that your sclera is white and equal bilaterally. And I'm now going to be assessing the cornea of the eyes, and I'm just going to be coming around the side at an angle. So just look straight ahead for me, please. Right. I note that your cornea is clear and intact, so I'm going to go ahead and check the other one. And once again, I note that the cornea is clear with no cloudiness present and is intact. Okay. As we move along with the assessment, I'm now going to be checking for, I'm going to be checking your peripheral vision. So I'm just going to be moving my hands around your face. So when you see my fingers, just please say now. Okay, so start now, now, now. Okay, I do note then that your peripheral vision and your cranial nerve number 2 or optic nerve is intact. Alright, so now we are going to be assessing your extraocular movements, which is your cranial nerve number 3 or ocular motor, cranial nerve number 4 or trochlear, and your cranial nerve number 6, which is your abducens. So I'm just going to be having you follow my pen, and I'm going to hold on to your chin for stability. Go ahead and start. I'll go slow. Alright, so I do note that your extraocular movements are intact, and I note that your eyes both track symmetrically. Alright, now I'm going to be checking for accommodation, which is your cranial nerve number 3 or your ocular motor nerve. So what I'm going to first have you do is just go ahead and focus on my finger off in the distance, and I do note that your pupils are slightly dilated, so I'm going to come closer, and I do note that your eyes constrict and converge towards the midline, and they do dilate and constrict bilaterally. Alright, now I'm going to move on to assess your pupil response to light, which is once again your ocular motor or cranial nerve number 3. If I could, and I'm just assessing how your pupils constrict. So if I could just have you look straight ahead, and I'm going to be shining the light in the eye twice, in each eye. So first, okay, and the second time I'm going to be noticing how the opposite eye reacts. Okay, so once again, know that they constrict. And again, I'm checking consensual. Okay, so I note that your eyes do constrict symmetrically. I note that your pupil is round and even. And I note that the pupil constricts from about 4 millimeters to 2 millimeters. And after this assessment, I do note that your cranial nerve number 3 is intact. Okay, Ms. Rogers, this is going to now be the last part of the eye exam. I'm going to be once again assessing your cranial nerve number 2 or optic nerve, and I'm going to be using an ophthalmoscope. So I'm going to be shining a light into your eye, and I'm going to be assessing the inner back portion. Do you have any questions before we begin?
No.
Okay. And I do note that I have 20/20 vision, so it is at a neutral setting. So I'm going to go ahead and start from a distance so that I can check for a red reflex. Going closer. Okay. And I note that the optic disc is a creamy yellow. I note that the arteries are red in color and that the veins are larger in diameter than the arteries. I note that they are smooth and not tortuous. I note that the fundus is a light red. I note that the macula is 1 disc size in diameter, and the right eye appears to be intact and healthy. Okay, and now I'm going to be examining the left eye. So once again, I'm going to be looking for that red reflex. Okay, and come closer. Alright. So I am noting that the optic disc is a creamy yellow. I note that the arteries are red and that the veins are larger in diameter than the arteries. I note that they are smooth and not tortuous. I note that the macula is 1 disc diameter in size. I note that the fundus is a light red, and the left eye also appears to be intact and healthy with no concerns. And that concludes our assessment today. Thank you for your time.
Thanks.